Hi, I'm Tony Preston, here again talking about governors and accessories. We can do some range of motion testing to see what's going on with her body. If we pull this out, we can see that this adductor has a pretty good length to it. If we pull the adductor out on the other side, we can see that this adductor stops about right here, a little bit short of where the other adductor is. The idea of governors and accessories says that patterns of pain and dysfunction have components in them. Some components are more governing, some components are more of accessories. The governing components tend to control the accessory components. So in this thinking, the governing pieces kind of elicit a need for protection in the system. On her, that adductor is governed by a number of different pieces in her system. It's governed by the joints around it. It's governed by some components in the pelvis. It's governed by some pieces in the spine. It's also governed by this lower portion of the lambdoidal suture. When I move it in a specific direction, it tends to release the need for the tightness in that adductor. If you're not appropriately trained as a therapist, please don't try this at home. You can create some problems. You need to understand basic contraindications and cautions before you do this. At this point, her occiput is beginning to soften, and the suture is beginning to open between the occiput and the parietal bone. There we go. Now I should be able to come back immediately and look at this adductor and see that it'll actually come out quite a bit further. I could have dealt with the governors at several different levels. I could have dealt with the problem here in her femur acetabulum, here in her SI joint, up in her lumbars and sacrum, but I chose to deal with the highest governor, which is up here in her cranium. That's the governors for adductors.